The most common cause of postoperative airway obstruction is A. Loss of pharyngeal tone in a sedated patient. B. Weak diaphragmatic contraction. C. Redundant pharyngeal tissue. D. Laryngeal edema. The correct answer is A. Airway obstruction is common and potentially devastating complications in the postoperative period. The most frequent cause of postoperative airway obstruction is the loss of pharyngeal muscle tone due to the residual depressant effect of inhaled and intravenous anesthetics and the persistent effect of neuromuscular blocking drugs. For every 1 mm Hg increase in the arterial PaCO2, minute ventilation is increased by A. 0.5 liter per minute, B. 1 liter per minute, C. 2 liter per minute, or D. 4 liter per minute. The correct answer is C. Under normal conditions, minute ventilations increased by approximately 2 liter per minute for every 1 mm of Hg increase in the arterial PaCO2. The normal ventilatory response to carbon dioxide can be significantly depressed in the immediate postoperative period by the residual effect of drugs. After reversal of neuromuscular blockade, pharyngeal functions returns to baseline when the adductor pollicis strain of 4 ratio is greater than 0.9 or 0.7 or 0.5 or 0.4. The correct answer is A. Measurement of strain of 4 ratio is commonly used to assess the reversal of neuromuscular blockade. Significant clinical weakness may persist to a ratio of 0.7 and the pharyngeal function does not return to baseline until the adductor pollicis strain of 4 ratio is greater than 0.9. Administration of 5 liter per minute of oxygen by nasal cannula result in an FiO2 delivered of 0.45, 0.41, 0.34 or 0.28. The correct answer is B. As a general rule, each liter per minute of oxygen flow through the nasal cannula increases the FiO2 by 0.04. As in this question, 5 liter per minute resulting in approximately 0.41 FiO2. In 5 liter, there will be increase of 0.04 into 5, that is equals to 0.2. And as we know, in the atmospheric air, there is 21% of oxygen. So, the total FiO2 will be 0.21 for room air and additional 0.2 that is due to the 5 liter of oxygen, as each liter of oxygen increases the FiO2 by 0.04. So total will be the 0.41. The most common cause of systematic hypotension in the postoperative care unit is intravascular volume depletion, myocardial ischemia, residual anesthetic effect, or vasodilatation. The correct answer is A. Intravascular volume depletion or hypovolemia is the most common cause of hypotension in the postoperative care unit. Common causes of decreased intravascular volume in the immediate postoperative period include ongoing third space translocation of fluid, inadequate intraoperative fluid replacement, and loss of sympathetic nervous system tone as a result of spinal or epidural blockade. Bleeding should be ruled out as a cause of hypovolemia in patients who have undergone a surgical procedure in which significant blood loss is possible. A sympathetic block above which level can result in bradycardia and hypotension T4, T6, T8 or T10. The correct answer is A. A high sympathetic blockade, that is T4, can result in the bradycardia and hypotension secondary to the blockade of cardioaccelerator fibers. This should be treated promptly with vasopressor such as ephedrine, as cardiac arrest secondary to the bradycardia and hypotension can occur. Ephedrine is used when there is severe bradycardia and hypotension. Which of the following postoperative hemodynamic abnormalities is the most predictive of unplanned ICU admission and mortality? Tachycardia, bradycardia, hypotension or hypertension? Correct answer is D. Hemodynamic alteration in the postoperative period can have a negative impact on the outcome. Surprisingly, postoperative hypertension and tachycardia are more predictive of unplanned admission to the critical care unit, and these are also has higher mortality rate than the hypotension and bradycardia. Postoperative premature ventricular contractions most commonly are result of QT prolongation, excessive beta blocker administration, increased sympathetic system stimulation, or residual volatile anesthetics. The correct answer is C. PVCs and the ventricular bigymny are common in the postoperative period. PVCs most often reflect increased sympathetic nervous system stimulation, as these are seen with hypoxemia, hypercapnia, and acidemia. Which of the following intraoperative factor is predictive of postoperative delirium? Blood loss, anesthetic technique, intraoperative hypotension, intraoperative hypertension. The correct answer is A. Intraoperative factors that are predictive of postoperative delirium include surgical blood loss, the number of intraoperative blood transfusion, and hematocrit less than 30. Intraoperative hemodynamic derangements and the anesthetic technique do not seem to be predictive of postoperative delirium. Each of the following increased the risk of postoperative delirium except advanced age, pre-existing cognitive impairment, alcohol abuse, chronic pain. The correct answer is D. Many adult patients at risk of postoperative delirium can be identified preoperatively. The most significant preoperative risk factors include advanced age, preoperative cognitive impairment, decreased functional status, alcohol abuse, a previous history of delirium. Chronic pain is not a risk factor for postoperative delirium.